All right. Well, good afternoon, everyone, and welcome to Public Health's virtual education series, Wažookį, Family Conversations. I'm Renelle, public health nurse, and I will be moderating today's session. The goal of this series is to gather, learn, and share about Ho-Chunk culture, resources, services, and the connection to health. In public health, we focus on prevention, promotion, and the protection of the health and well-being of our communities. Health and well-being are rooted in many aspects of our lives, from our physical body, our mental health, our spirit, the environment we live in, and much more. During these sessions, we will explore topics that can impact our health and well-being. Together, we will learn about tools and resources to improve our health and the health of our communities. Today, we're happy to have Pamela Gearing with us to talk about Ho-Chunk Nation's Tribal Memory Care Program. We will have about 45 minutes for Pamela's presentation, followed by some time for a Q&A. Please use the chat function to enter any comments or questions for our presenter. I'll help moderate the chat throughout the presentation and then read the questions for her at the end. You can also raise your hand or come off mute during the Q&A to ask your questions out loud. Any questions that we don't have time for, we will forward on to Pamela and email her responses back to the group. This session is being recorded and we'll be posting it to the Department of Health website on the public health page and on our Facebook page. Everyone, please welcome Pamela Gearing.
Thank you. Hi, I'm Pam Gearing and I'm the Memory Care Coordinator for the Ho-Chunk Nation. I have a little slideshow to present. So this is my information and you can call me at any time with questions or concerns. Next slide, please. So what does a Tribal Memory Care Coordinator provide? We can provide information to tribal members about Alzheimer's, dementia, and their caregivers' information. We can perform memory screens. We can help tribal members with dementia find social activities to keep them active. I can help tribal members with dementia plan for the future. I can connect you with caregiver support programs and support groups. I can help create places where tribal members with dementia can remain active and safe. Thanks for using Web. I will train businesses to be dementia friendly. Someone was knocking on my door. I apologize. Next slide, please. Alzheimer's or dementia, what is it? Next slide, please. So dementia, there's types of dementia. Dementia is like an umbrella term for loss of memory and other thinking abilities severe enough to interfere with daily life. Alzheimer's falls underneath that dementia umbrella, along with vascular dementia, Lewy body dementia, frontal temporal dementia, other types of brain issues such as Huntington's, or there's also mixed dementia, which is dementia with more than one cause. Next slide, please. Alzheimer's disease is a continuum from someone having no symptoms at all to being severe. When someone's asymptomatic, they have no cognitive symptoms, but positive biological changes are happening in the brain. During the early stages, which is called mild cognitive dementia, the early stage, you have some cognitive loss, but you still can be pretty functional. And then it moves from mild to moderate to severe based on how much interference there is with your daily activities. The more progressed it is, the more difficulties someone will have. Next slide, please. So just kind of a little question. Approximately how many Americans are currently living with Alzheimer's? Currently, there's more than 6 million Americans that are living with Alzheimer's disease. Next slide, please. And that leads to the question, how many Americans are providing unpaid care for people living with Alzheimer's and other dementias? Over 11 million Americans provide unpaid care to people with Alzheimer's or other types of dementia. Next slide, please. How does dementia affect Native people? 54% of American Indians who are 72 years old to 95 years old have cognitive impairment. Vascular injury, which is caused by untreated hypertension and diabetes and Alzheimer's disease, equally contribute to this. I have some other statistics as we go along here. So next slide, please. This is just a little information about unrepresented. Native Americans are underrepresented in research. Only about half of Native adults think dementia is a major problem for American Indians. So having a family member with dementia was linked to perceived personal risk of the disease, which is an increase in knowledge and therefore an increase in willingness to participate in dementia trials. Urban Indians are more likely to indicate a willingness to participate in dementia research. However, 83% of Native participants would be willing if they thought it would help other people. Next slide, please. So I'm going to show you a little video about dementia from the perspective of Native Americans. So The River is a Native story about dementia, and it's very impactful. So I think you're going to use it, you're going to play this on a different way, or are you going to try to do it through? I think if you click on that one time, an arrow should come up so we can play it.
Yep, I forgot to share my sound though, so I'm going to stop sharing and reshare real quick.
Okay.
For every human being, life is like a river. The constant flow of water represents our daily experiences, from routine and familiar to those that take us by surprise. If we're lucky enough to live a long life, we'll experience the river in each of the 4 seasons: spring, summer, fall, and winter. Spring is early childhood, when the river is new to us and we're just learning about all the fish, birds, and animals that connect with it. Summer is our experience from childhood to adulthood, when we transition from relying on others to navigating the water and harvesting for ourselves. Fall is adulthood, when we know the river and its resources and dangers well enough to provide for others, raise children, and chart our own course in the world. Winter is elderhood, when we've acquired the deepest knowledge and wisdom, but also start to experience changes from the aging of our bodies. Dementia is like navigating a river freezing in a long winter storm or even a blizzard. Storms can come in any season, although they're most common and most severe in winter. The wind and snow make it harder to see and hear the water. Everyday life, the natural flow of the water, becomes harder to navigate. Thinking activities that used to be easy, like planning a fishing trip, buying bait, planning meals for the trip, and reaching out to others to join the activity, become increasingly difficult. However, even at the start of a winter storm, emotional experiences and feelings remain strong. For example, the love of fishing, the memory of the sunlight bouncing off the rippling current, and the joy of company. The longer a person lives with dementia, the thicker the ice on the river can become. The everyday flow of experiences beneath the surface is more difficult to reach and navigate without help. Eventually, even deep and lifelong emotional and spiritual connections are harder to access through the thickening ice. This story of a river in a long winter storm helps explain the experience of dementia. Facts, recent memories, and complex thinking become harder to reach in the thickening ice, while deeper memories and emotions continue to flow under the surface.
Now to figure out how to get to the next slide. Yep. Sorry about that. All right, there you go.
So, as American Indians and Native people, we take care of the elders. They're the lifeblood. They carry our cultures. Elders living with dementia can have active roles in our lives, and they can continue to be leaders and storytellers. They pass down our traditions and languages. As a Native person, you and the people you are in your community have many strengths. Your resilience, your strengths come from your culture, traditional ways of life, and powerful sense of community. Next slide. So how can I help you? Next slide. So I can help people with connecting them to diagnoses. I can help with screening for possible dementia, or possibly sometimes screenings help you identify that you just need to see your doctor and it might not even be dementia. It might be something much less serious. I have information on healthy brain, healthy living that I can provide to people. I can connect people with support groups. I maybe can just be a problem solver, help you talk through what needs to happen. And basically help address safety planning, things that might come along as the disease progresses. So in order to have a referral to our program, next slide. Oh, never mind about the referral yet. So healthy brain and healthy heart are one of the main things I like to stress, along with the public health aspect of things. As you can see on this information, 1 in 9 people in the US have Alzheimer's disease. But when you go to the American Indian population, 1 in 3 people end up with dementia of one sort or another. And you are more at risk for developing dementia if you have high blood pressure, diabetes, smoke, or if you smoke. Next slide, please. You can protect your body, heart, and mind by doing some simple things. like scheduling an appointment with your doctor annually, keeping a healthy blood pressure, being active, going for a walk every day is very beneficial. Maintaining a healthy weight, eating a healthier diet with fresh fruits, vegetables, whole grains, and fish. As I already stated, stop smoking. Managing your blood pressure, diabetes, and weight loss. And talk to your doctor if you feel like you have any issues with your mental health or have any concerns about your memories. Next slide, please. The other thing that we have here at the Nation is the Alzheimer's Family Caregiver Support Program. This is a program that is coordinated by and administered by the Social Services Department, the Children and Families Unit. In order to spend these monies, you have to have prior approval before purchasing any services. To become eligible, you have to have a written diagnosis of Alzheimer's disease or other irreversible, dementia from a physician or other qualified health professional. These funds help tribal members with dementia remain living in the community. That is the whole goal of this program, is to help people live independently in the community. And funds can be used for a wide range of things such as respite, home care services, personal care, meal preparation, medication monitoring, emergency response systems, PERS systems. Although we usually expect people to use other sources first, but this money is available to help people within the nation. There's also National Family Caregiver Support Program, which is through the counties in which people live. So I could also help people get connected with those if they need additional support. Next slide, please. So that's the information I have for you at this time. If you have any questions, I'm open for questions right now. And I'll leave this information on the screen, which all referrals to my program come through our initial response program. And that contact information is there for you. So are there any questions?
Pam, I know there was a question earlier in the group. Is there an age requirement for your services, or is it based more on disease diagnosis and need?
It's based totally on diagnosis. There's no age limit. So it looks like Lynette maybe has questions, but she doesn't have a computer that she can ask them on.
Oh, I went and borrowed one.
Oh, okay.
But no, because, like, I don't know, you said to talk to your doctor. Because, like, yeah, my memory is, like, really bad.
Okay.
I feel like it's getting worse. I don't know if it's, like, maybe stress related or what, but I guess I would make a appointment with Dr. Cox and get a referral or something.
I also could do a screening for you if you would like, Lynette.
Okay. Do I need an
So-
appointment or just email or?
Call that initial response program number on the screen right now.
Oh, yeah, I see it.
Huh?
I see it, yeah.
Yep. And tell them you would like a memory screen from the memory care coordinator, and I'll call you and set up a time.
Okay, sounds good. 7.
Pam, this is Mary. I don't know, Ronald, if we're just supposed to talk. I'm not sure how this process works for sure. Is
You
somebody
go
else
for it,
wait-
Mary.
Is somebody else waiting to speak? Okay. Pam, with the AFCSP money,
Mhm.
do you just want to touch on that there's money that goes to the tribes, but there also is money that goes to the county, and then maybe share a little bit more specifically that there's that additional national money as well?
Yep, I did mention that, but yes, the counties also in which you live also have Alzheimer's family caregiver support programs. The issue with that is if you come through the nation and get that money, that we have a small allotment, it's not a lot of money, but you cannot go to the county then also. That money is either you get it from the nation or you get it from the county. But the counties then have national caregiver support monies, which is a different pot of money used for similar things, but assessment for those goes through the county in which you live.
And I think we've come up with some really creative ways that we help family members to decide how they want to utilize their money. Sometimes it's used more for those social recreational things. Pam, I think maybe you got some stuff on your back shelf there where we've used those little animals, that little real
Yep.
popular little fuzzy guy. And
Yep.
then we've really like tried to, I don't know what else you got. Pam's got a bunch of stuff in her office there.
I do. I have fidget tools. I have safety things for, I have medication management boxes, electric reminders. I have the pets, which Mary talked about, which are a comfort thing. Let's see, what else do I have? I have automatic stove shutoffs that I've provided to people to keep people safe when loved ones have to work. I have a digital clock which can talk and tell you what time it is and maybe assist in that way. But we also, if somebody thinks they know something that could benefit their loved one, that is something we can buy. It's really money that's meant to individually help whatever the person needs at that time. So we could purchase almost anything with that money that would benefit the caregiver to provide good care to someone.
And again, I know we've helped locate, wherever anybody is in the state of Wisconsin, because your grant is only for Wisconsin. But if
Correct.
there's anybody out here that wants to make a referral for someone outside of Wisconsin, that initial response program will still take all referrals, and then we'll navigate helping people outside Wisconsin. But Pam, she has a lot of connections to all the dementia care specialists in the whole state. And
Yep.
every tribe has a dementia care specialist, right, Pam? The 11 tribes?
Yep, all tribes have a dementia care specialist now. The state expanded that program in the last 2 years to include every single tribe. And every county in the state also has a dementia care specialist.
Yep, every county. So there's a lot of resources out there. Sometimes it can be overwhelming, but like Pam said, all intakes for the services at Child and Family Services goes through initial response. And so any specific questions, then Pam can do an outreach that way. And Pam, maybe you can talk too how sometimes you utilize the TADRS and adult prevention and protection to help you as well.
Right. So if there's concerns about adult protection or neglect, I can connect people to the Adult Protective Services workers. And if there's additional resources beyond what I have available for people, we have 2 TADRSs, tribal, can't think of all the terminology. Anyway,
Tribal Aging
resource.
and Disability Resource Specialist, TADRS.
Yep. We can connect you to them to help as well. And they have a wealth of information and resources for people. So we're like the center of helping somebody get anything they might need to help them remain in their home, even if they do have dementia.
know one thing, Pam, you and I, when Pam was getting ready for this presentation, so often we hear about Alzheimer's, but I really like that slide, Pam, where Alzheimer's is a form of dementia, right? Isn't that, I don't know what number that was, but that was a really good slide about the different kinds of dementia
Right.
that there are. I don't know what number your slide was.
It's number 4. So if you would like to go back to 4. So yes, and this is just a small list too of the different types of dementia. And so any kind of memory impairment that's a bit affecting anyone's ability to function in their daily life, that is possibly a form of dementia, and we can help you navigate that system. So our goal is to help people early. Again, we want to focus on healthy choices to help with brain health, which then reduces the risk of dementia. So we come at it from many different angles, from helping people reduce their risk to helping people when they are totally involved with dementia and need more and more support.
Does
I
anyone
don't know
else?
if does anyone else have other questions? I was just wondering, Pam, with the different types of dementia and the treatments for each type of those, when you do find out, is it important to know the type you have? Because is the treatment for the specific type maybe different? Or maybe you don't know that. I just don't know that I know that either, but is it
Well,
different?
I know there is a lot of research and medications to help slow the process. So early intervention is important. I know it's very scary to end up with a diagnosis, but as I stated earlier, many times things like a UTI can cause someone to have memory issues. There are things that can mimic over medication, dementia type symptoms. So, first and foremost, we want to screen people and then connect them with their doctor to talk about resources that way. And then, yes, there are treatments available. There's no cure for dementia or Alzheimer's particularly, but there are treatment options.
And if you're interested in learning more about treatment options or more about Alzheimer's and dementia, we did have Heidi Neely from the Alzheimer's Association a couple weeks ago, and you can find that on the Department of Health website page under the Public Health Division tab. You could watch that recording.
Yes, and she participates in a lot of the activities that I am involved in. And Heidi is going to do a presentation with me later on this year yet. Her and I are talking about that. And I don't know if I could plug the Walk to End Alzheimer's. The Ho-Chunk Nation is sponsoring that. And that is September 21st at the Lunda Park in Black River Falls. And you can register and help support the fundraising. The Walk to End Alzheimer's donates the money all back to research and helping people with dementia, and not just Alzheimer's, all dementia.
Pam, I was late to log on as well. I don't know if we mentioned anything about support groups. Can you tell us anything about support groups?
Yes, there are support groups in every county. There's caregiver support groups. There's day programs in most counties. Again, those are the things that I could help connect you with. I don't have a list right now. Oh, thanks for posting that, Renelle. Is it Renelle? Am I saying that correctly? But I appreciate you
are, yes.
putting the link in the chat.
Yep, so if anyone is interested in attending the Walk to End Alzheimer's, I put the registration link in the chat. I can also send it to you by email as well if you're looking for it.
Yeah.
Does anyone have anything else? Mary, are you out of ideas?
Well, I'm sorry, but I was looking for the chat. I'm like, oh, there's the chat button. So sorry for not using the chat and raising my hands, but all these different platforms sometimes can be interesting to navigate. So as we all have to navigate these technology things, but I think if Pam, you're willing or I'm willing, my mom just passed away in January, and she had dementia. And so some of these things are very near and dear to our heart because not only have we worked in the field many years, but we also have had family members that have been inflicted with the disease. And it's a very difficult thing to see. It really is.
And to navigate the different options. My husband's father had Alzheimer's dementia, as did his sister, who both have passed away from the disease. My husband's family is very actively involved in the research component of this, and a couple of them are in a research program at UW-Madison right now. Looking for research and solutions to the disease, and there has been a lot of progress. And so I just want to, state some positives as well. The screening and seeing your doctor can lead to finding out you have something other than dementia. But it also can help you with early diagnosis and treatment, which is beneficial. So please use that. If you have any questions at all, please do a referral to me, and I would be more than happy to talk with you about whatever your concerns might be.
Also, I think I see that like if there's a TAU, looks like Nakusa. I mean, Pam, you're able to come out and do presentations during, I guess during lunch hours, or even if they want to schedule something extra?
Yep, I've gone to all the TAUs at least once and some twice. But I would love to come out and do presentations for people at the meal sites. I thought Nakusa was going to talk. They lit up for a minute.
I don't know if you can put the
Yeah.
video in here. Maybe you can.
Hello?
Yep, we can hear you.
go.
Oh, yeah, you're welcome to come here anytime you want.
Okay, I will set up a time.
Yep, all right. Thank you.
Yep.
All right, folks, if we don't have anything else, I will close us out.
Thank you for having us.
Yeah, Pinagigi, thank you, Pam, for sharing what the Tribal Memory Care Program can do for our communities. And thank you, everybody, for joining us today. As a reminder, this session is recorded and will be available on the Department of Health website and our Facebook page. We look forward to seeing you at our next session on Wednesday, August 27th. We will be joined by Jenny Steele from Vivint Health, who will discuss Overdose Awareness Month. You can use the same link as today for all future sessions. Or if you'd like to add the recurring WebEx link to your calendar, you can email Jamie or I, and we will send you that link. I will put our emails in the chat. And we welcome all feedback about this program. If there is anything that you would like to hear about, learn about, or if you yourself would like to present on anything, you can reach out to Jamie and I. There's also a link in the chat that says Smart Sheets. That is a formal internet survey to provide feedback on our program. So we welcome any and all feedback to better serve you. Have a good rest of your day, everybody.
Thank you.